I walked into workroom for my night shift. I hoped for a quiet night, but I took over care for a 20-something-year-old male who suffered from self-inflicted gunshot wound to the head. We were considering a surgery where part of the skull was removed to relieve pressure. I walked into his room. A few minutes later, his wife walked in. She looked overwhelmed. I explained to her that the surgery saves lives. Unfortunately, it doesn't really reverse the damage that's already done to the brain. It is common for people to end up alive, but with significant disability needing a permanent breathing and feeding tube, unable to speak or interact with their surroundings. She quietly sat there with tears down her face. Then she agreed to let us to do the surgery. As I brought the patient down to an operating room, I had this gut-wrenching discomfort in my stomach that I couldn't really shake. I became a doctor to help people. In this case, I really wasn't sure if I was helping this patient. I wouldn't want the surgery for myself, and I felt guilty. At the time, I didn't have the skills to process the experience myself. I wish I had a tool to help me with it. This is the feelings wheel. The center is filled with main emotions like anger, sad, or happy. It is surrounded by more specific emotions that develop in response to the main emotions. There's a big difference between angry versus withdrawn, or happy versus hopeful. If I had this tool to identify the guilt I felt, I could have processed the emotions related to my experience instead of burying it down. It would have been better for my mental health by helping me with the symptoms of the burnout, and there are research to support this. I will get into that a little bit later. This is a common conflict healthcare workers experience every day. It's called moral distress. It results from witnessing or participating in events that go against the person's moral values. Eventually, it leads to moral injury. It causes feelings of guilt, shame, and anger. In the long run, it causes depression and burnout. One of the most common symptoms of burnout in healthcare workers is lack of empathy. Have you ever had an experience that a healthcare worker didn't seem to care about you? Most likely you have. That's how prevalent burnout is in healthcare. A recent study shows that the burnout rate in healthcare providers was 50%. Nearly 30% reported intent to leave. These are people who are in the middle of their careers who are expected to make up the main workforce over the next decade. The United States is predicted to see a shortage of up to 120 physicians within the next 12 years because of our aging populations. And healthcare providers leaving the field will worsen this problem. What does this mean for you? We have 2.6 physicians for every 1,000 people, compared to Italy that has 4 physicians for every 1,000 people. World Healthcare Organization says that you need at least 2.5 physicians for every 1,000 people to provide adequate care. If these people were to quit, then it leaves United States with 2 physicians for every 1,000 people, which is below the recommended number. And we will be getting a subcare healthcare. If you think you're waiting too long to see your physician now, then it will be even longer. The solutions to this shortage and burnout are complex. It will require policy changes that will likely take years to see the results. We need a solution right now that could help current healthcare workers to deal with burnout at their jobs. Well, come back with me to a day at the hospital. It was a typical morning on the weekend on neurosurgery service. You can easily recognize the resident who was on call overnight. They usually look physically and emotionally dead drained. I asked the call resident how she felt. He just laughed and said it doesn't really matter. And as a joke, I pulled out the feelings wheel, and she labeled her emotion as empty. She was surprised by how much it made her feel better. Naturally, everyone else in the room was curious about the feelings wheel and they started labeling their emotions. We were laughing about how terrible we all felt. Also, we did recognize it wasn't really funny, although we were laughing. Then as a group, right there, we ordered a big canvas of feelings wheel for our workroom with name tags for everyone. And this is what it looked like. We started moving our name tags around throughout the day. It was easy to use. It only took a few seconds to check on our mental state and be aware of how we felt. We found out that we all felt bad throughout the day. Simply knowing how everyone was feeling created an opportunity for a human connection. We asked each other about their experiences that made them feel a certain way. It got me wondering if this could actually help people. And I tried to learn more about mental health. World Healthcare Organization defined mental health as being essentially functional under stress using your coping skills. That makes me wonder, how do humans deal with stress? If you imagine a baby crying, what is the first thing that comes to your mind that would soothe the baby? It is their mom, right? Even adults crave human connections under stress. Most of us reach out to friends and family under stress, and it is difficult for us to seek that connection at work because it requires us to be vulnerable and admit an appearance of weakness. And it's not perceived well in the work environment. So, how can we deal with stress as adults on our own in the absence of our friends and family? When you're under stress, you first find a stressor and respond to it with some sort of action. For example, if you see a dog barking at you, you see the dog and you stay away from that dog. If you understand the situation, you will have better chance of taking an appropriate action. It's harder to identify the stressor with emotional stress. That's why people need practice managing stress under emotional circumstances. The feelings wheel is a tool that helps you label your feelings. When you know how you feel, it will help you rationally manage your response. And people have studied this. Researchers studied people who have fear of spiders. The participants had to look at a spider from a close distance, then eventually touch it, then measured their goosebumps. One group labeled their emotions during the experience, while the other one didn't. The results show that people who used their words to describe their experience had less goosebumps. It shows that people have physical response to their feelings, and that can affect the way you function at that moment. Have you ever been so angry that you thought your chest felt tight? That's because your heart is overworking to give you that feeling. Another group measured just that experience. They took a group of students and asked them to do difficult math problems. They even triggered them during the problem to make them angry. One group labeled their emotions during the experience, and the other group didn't. And their heart function was measured. The results showed that labeling their anger helped them to regulate their heart function in response to stress. So, simply labeling your emotions could have a significant effect on your stress tolerance. And this could easily be transferable in healthcare setting. It's a place where we have to perform at our best in an emotionally stressful environment. Simply labeling our emotions using the feelings wheel could help them process the experience in lifetime and reduce their physical stress response. What if we give healthcare workers an opportunity to take charge of their own personalized mental health at work anytime that's convenient for them? A wheel for the win, to give them a tool to help them take care of their own mental health so they can continue to help others like they wanted to when they chose medicine. And everyone should download the feelings wheel and ask yourself how you feel.